Hello, this is Dr. Hussain from DMH Functional Medicine. Today we are going to present you a study on vitamin A in relation to thyroid health. So remember, this is just for informational purposes, educational purposes. This is not personalized medical advice. You need to speak to your doctor if you have any health issues. So this was a study from 2012. The effect of vitamin A supplementation on thyroid function in pre-menopausal women. So let's see what group of people they studied and what they did. The conclusion is, we'll get back to the study in a second. The conclusion is that vitamin A supplementation caused a significant reduction in serum TSH in the obese and non-obese participant. We'll get back to the participants in a second. Serum T3 concentration was increased in both obese and non-obese vitamin A patients that got vitamin A, and serum T4 decreased in all three groups. So let's look at the study in a bit more details. They studied 84 women aged between 17 to 50 years of age. 56 of those, 2/3 of the women were obese and 1/3 were not obese. All the obese women were randomized to either receive 25,000 units of vitamin A daily, or they were receiving placebo. The non-obese women were all given vitamin A 25,000 units daily. The result was, as we just mentioned now, increased T3. Keep in mind, T3 is the active form of thyroid hormones. That is the form of thyroid hormones that actually have the physiologic impact on the cells and does what it needs to do to change our metabolism. It has decreased T4 and a decreased TSH in both groups, which signifies if you have less TSH, the body is sensing we have more thyroid hormones available. We do not need to stimulate, the pituitary doesn't need to send off more thyroid stimulating hormone to increase the production, simply because we have sufficient. So vitamin A supplementation may be the actual treatment we would need in some patient athletes, and this study indicates that. Maybe we do not need to give actually thyroid hormones. Maybe we just need to make sure, if they are vitamin A deficient, that they get sufficient amount of vitamin A, either in the form, and that's always the best, the whole food version. If you eat food with sufficient amount of vitamin A, that would always be the better solution. But if for some reason you're not able to do that, supplementation may be what you need, rather than having a prescription medicine that would require you to be followed more closely and maybe also have more side effects. So this just goes to show that we may need to look at thyroid health and thyroid hormones in a different way and try to see it in a more wider perspective to treat our patients. I hope you enjoyed the video. Do give it a thumbs up. Share the video with your friends and family. Could be someone is vitamin A deficient, could be someone is hypothyroid, and up to 20% of people may be hypothyroid, and 50% of those, half of people with hypothyroidism, they're really never diagnosed. So it's a very big, in numbers, it's a very, very important disease. Subscribe to our channel and click the notification bell so that you're updated with videos as we bring up new ones. Thank you for watching, and see you in the next video.